Welcome back to Headlines and Heartlines, where we go beyond the headlines to bring you the stories and people shaping our community. I'm your host, Vanesa Brashier, editor and publisher of Bluebonnet News, and today we're talking about something that affects every single person in Liberty County: emergency medical care. As of April 1st, Acadian Ambulance Service has taken over operations in Liberty County, replacing Allegiance Ambulance Service, and with that change has come a lot of questions from the public about response times, coverage, staffing, and what this means for our community. Joining me today is Robert Crane, Operations Manager for Acadian Ambulance Service. Robert is here to help us understand what this transition looks like, what services are being provided, and what the future holds for emergency medical care in Liberty County. Robert, thank you for being here today.
Yes, ma'am.
So for those who may not be familiar, can you tell us a little bit about your background and your role with Acadian Ambulance Service?
So I've been with Acadian Ambulance for 19 years in July. I was the primary supervisor in Orange County for the previous 10 years. I've been an operations coordinator for a year and a half, and then I just became the operations manager a little bit earlier this year when our previous manager moved to Houston.
Okay, and your office out of Beaumont?
Yes, ma'am.
Okay, so what has the transition into Liberty County been like since April 1st?
It has been an opportunity to learn. We asked a whole lot of questions before we came in, learned everything we could, but you never really know what's going on until you start.
So have you come up against any challenges?
Nothing that we haven't overcome.
Okay. All right. And Acadian's been around since 1971, right?
Yes, ma'am.
Can you give us an overview of the company and what sets it apart from other ambulance services?
So Acadian's been around since 1971. We've transitioned. We're actually a 100% employee-owned company at this point, and our management team, I've watched it actually develop over the last 19 years that I've been with Acadian, and I have to say the current team that I work with from our president on down is the most patient and medic-focused group I have ever worked with. Our goal and our slogan right now for Acadian is to take care of patients and patients' lives and livelihoods.
Okay.
So serving both our patients and our medics in every way we can.
Okay. And how many parts of the country are you in with Acadian?
On the ground ambulance side, we are in 4 states currently: Texas, Louisiana, Tennessee, and Mississippi.
Okay. All right. So this change has been a big shift for people in Liberty County. What steps were taken to ensure there wasn't a gap in emergency coverage during the transition?
So we worked with the county on information gathering and preparing for however many ambulances we would need for the anticipated call volume. Since January, we've been stockpiling supplies, ambulances, and people over in Beaumont and Houston, trying to get everything lined out. So whenever we moved in at midnight, we were moved in and 100% ready to go. In addition to our mainline trucks out of Liberty County, we actually staffed 5 units out of Beaumont to be ready for that transition and made sure there were 0 gaps.
Okay. There's been some concerns in the community. I'm sure you've heard them, that Acadian would be operating fewer ambulances than before, but can you address that directly?
So, from my understanding, Allegiance was running a total of 7 ambulances in the county when we came in, which was 2 in the cities, 1 in Cleveland, 1 in Dayton, and then 5 in the county. We are still staffing 5 in the county. What we are doing is adjusting from a strictly 24-hour ambulance staffing model to both 12-hour power trucks and 24-hour around-the-clock 911 trucks. The goal is to focus the highest number of hours in ambulances where the call volume is actually at. Not as many people call at 3 o'clock in the morning as they do at 1 o'clock in the afternoon.
What's the difference between the 2 trucks?
Just the hours they work. So we call them power trucks, and they might work 9 a.m. to 9 p.m. or 11 a.m. to 11 p.m. It's adjusted for the calls and the volume in whatever district they're working in.
Okay. And so how do the reserve units factor into coverage when call volume increases?
So the reserve units are there to back up the system. So if we do see a surge, we can call people in to back it up. We also can utilize our trucks from Beaumont. We do a lot of transfers back and forth to Houston out of our Beaumont district, and a good number of those are MICU or paramedic level trucks. And when they're driving through the county, they count as additional assets. So my dispatchers can pull them and add them to the system trucks for Liberty County, even though they're not dedicated to Liberty County. So if they need, they can grab them and move them around and do whatever they need to do with them.
Because you have other truck stations so close by, how would you respond in a major medical event? God forbid we have one, but how would you respond in a major medical event?
In a major medical event, we would actually mobilize everything from Lafayette through Houston, just start moving the entire on-duty ambulance pool, east or west, depending, and backfill. So we would pull from Louisiana to Orange to Beaumont to Liberty County, east and west, to send everything. That way we don't lose coverage on one side or the other, but we keep pushing from the outside. At the same time, we would call our regional partners for mutual aid through the EMTF and the state of Texas, and also the other providers who are closer around Liberty County to join us in any sort of large-scale disaster response.
How did y'all decide how the 7 ambulances were going to be distributed across the county, and why were these locations chosen?
So the 7 ambulances is based off of the call volume provided through the 911 system.
Okay.
And the locations are actually based on a statistical analysis of when and where and how many calls and where they transport to. So with that data, we gave it to our business intelligence and our CAD teams, and they actually created maps and models of when and where the call volume is at. So I want to make sure we have the most ambulances where we're going to need them, when we are going to need them there. And it's predictive dispatching. Predictive CAD is another term for it. We're just planning ahead so we can have ambulances in places we need them that have access to the right directions. Because if I have them at a dead-end road and they can't get out to anywhere except one way, it doesn't do good for overall coverage.
Where are you finding that most people are being transported whenever you pick someone up?
HCA Kingwood actually is by far the majority of our transports right now.
Okay. But you're going beyond that too, I guess, if a person wants to go to a different hospital.
In as close as the closest, most appropriate facility. We try to honor patient requests, but depending on what's going on, if you want to go to UTMB Galveston from Liberty County.
Yeah, no, that's too far. I meant like Memorial Northeast.
Oh, yes, they're on the list. Memorial Northeast. I've had crew took somebody to Memorial Herman downtown the other day.
And I guess
where they needed to go.
Methodist Hospital in Baytown would even be on your list, wouldn't it?
Top 3 would
Top
be,
3.
Yep. The 3 we've discussed, Baytown, Kingwood, and Northeast are the top 3.
Okay. And they all have trauma centers, so that's good. They do, right? Am I correct in saying that? Okay. All right.
When we came up with our transport plan, we actually brought in our Texas medical director and went by all the hospitals and visited with their administration and their staff to ensure that they had what we were looking for, and we could put out guidance to all of our medics as far as the appropriate types and available services at all of the hospitals.
Liberty County is a large, mostly rural area. We do have cities, and Liberty is served by its own ambulance service. Cleveland still has Allegiance, I think, and does Dayton also have Allegiance?
Yes, ma'am.
Okay, so you will be serving the areas outside those 3 cities, correct?
Correct.
And then assisting whenever you're asked for mutual aid, I would assume.
As much as we're available.
As much as you're available, because your primary obligation is to the people in the outside of those areas in the county.
Yes, ma'am.
Okay, so what are the biggest challenges in Liberty County when it comes to providing ambulance service here?
Time, distance, access to healthcare facilities, to primary care transport facilities, and the Trinity River. I've learned a lot about the geography and the roads in Liberty County over the last 3 months. And I love the river, but it does not help when it comes to responding to emergencies.
Yeah, there's some pretty rural areas where it takes a long time just to get down the roads to get to some of these people.
Yes, ma'am. There's only 3 places in the county that cross over the Trinity from east to west.
Yeah, so, Romare, Moss Hill, and Liberty.
Yes, ma'am.
Okay.
And let's just say there's a wreck and one of those is backed up or trafficked up, and then the other 2 are going to catch the rest of the traffic. And next thing you know, you're actually looking at a system problem that we have to address.
Okay. But you have ambulance stationed on both sides of the river, correct?
Yes, ma'am.
Okay. But it still becomes an issue of distance if you're pulling someone through Dayton and trying to get through traffic there and make their way all the way to Moss Hill or Tarkington or somewhere like that if they're trying to get around a traffic issue.
Yes, ma'am.
So how do you balance response times when you're covering such a wide geographic area?
That's where the types of trucks come in. So our 24-hour trucks, for safety reasons, we try to keep them they always go back to their own stations as much as possible, so they're not driving around on the streets all day and then trying to stay up all night. So that's where our power trucks come in, and we do position them around either to backfill when somebody gets a call or to pre-position them for busier times. One of our 12 hours is actually, so we have a 12 and a 24 up in Plum Grove because of the call volume. And we can also move a 12 over to Tarkington to be in between Plum Grove and Moss Hill and vice versa. I gave our dispatch center a number of different scenarios and options and available posting plans depending on what's going on.
Okay. So what should residents in the more remote areas realistically expect when they call for an ambulance?
So when this was handed to me, I was not given a response time criteria just yet because there wasn't one built in whenever the RFP was put out. So my goal right now is to take what I'm given and come up with the absolute best possible response time, and then we're going to revisit it with the county and set an expectation response time, even if it means adding more trucks, if it means moving some stuff around. We're going to find what we can reasonably make as a response time. It's been about what I expected whenever I made the plan, but we're only 9 days in at this point, so I don't really have enough data to hammer it out.
Have the response times been okay so far?
They averaged out where I expect them to be. There's been a couple longer responses. We've actually had some unanticipated difficulties. This goes with those adapting to different areas with street names. There are actually like 800 different aliases for street names in Liberty County. So you might have 321 that has 5 or 6 different names in different areas.
It's called Cleveland Street, and then it's also called Houston Street.
And I call it for our legacy districts where we've been for the last 10, 12, 14 years, we know that. Mm-hmm. For Liberty County, it's brand new. So there's been a couple of times where it took a few minutes to figure out where the person was actually talking about. That should resolve, actually, besides the manual process of updating our CAD for each road. We're actually switching over to a different system that's an AI-based CAD system here in about 24 days, and that'll actually create a CAD-to-CAD interface with the county. So the county 911 dispatchers will be able to pinpoint the call for us because they have the experience. Like, we want the people with the most to help us
coordinate
especially at the beginning. Yep.
Yeah.
And if they can say, hey, it's right here, even though it doesn't show on the map, this is the call right here. We've been there 3 times this year.
Okay.
You can't replace that kind of knowledge with anything.
Can you explain a little bit about the staffing model, about the 24-hour versus 12-hour shift? What does that look like in practice?
So as a company, we've done our best to actually eliminate 24-hour shifts because of fatigue and other safety concerns.
Mm-hmm.
But the 24-hour model, there's multiple different ways it works. At Acadian, we don't work anything more than 24 hours, so the 48-96 or 72 on, 72 off schedules that a lot of fire departments and other services use don't work for us. So we have traditional 24 on, 48 off there's some modified versions of that where you work 1 day on, 1 day off for 4 days, and then you have 4 days off, and some other versions of that. So you get more of a long weekend versus the standard 24 on, 48 off. That can be a little repetitive at times.
Okay. So how does Acadian ensure that the paramedics and EMTs are prepared for the wide variety of calls they face in a rural county?
So we have a standing quality improvement department. We have our quality improvement coordinator, Michael Cummings, out of Beaumont. He, in his team, he's got 4 assistant quality improvement paramedics that assist him. They do audits. They have training. We actually have MCI training for all of our staff coming up in the next month or so for our quarterly training. We also work with our fire departments and do training in our fire departments. But when we receive any sort of complaints, concerns, or we find something in a random audit, we have peer reviews with our crew members and education or follow-up, or we even get with hospitals to do training and adjust to what we need to do for any area or any system problems that might come up.
Okay. What level of care can patients expect from Acadian when an ambulance arrives?
So all of our units that we have or will run in Liberty County are MICU paramedic staffed units. They have full MICU capabilities. Eventually, I hope they will all have IV pumps on them and some other stuff that we haven't gotten for our trucks, but we're trying.
Can you explain the difference for people who may not understand the difference between paramedics and EMTs?
So the state of Texas actually recognized, the National Registry does at this point, 4 different levels of provider. So you have ECA, which is the entry level first aid, and you can drive an ambulance. You have an EMT level that is your standard partner. They drive, they provide patient care. They can be the primary provider for some patients. There's an advanced EMT level, which we do utilize at Acadian in some districts and even in our legacy department towards Beaumont, that can provide up to an ALS level. So they can provide a lot of the same things that carry narcotics, and they can do everything in the state of Texas just shy of giving cardiac medications. We actually have a 24-hour advanced EMT truck in Southeast Texas that's a primary provider, and we were doing an audit, and one of their medics had 4 cardiac arrest saves just last year as a primary provider. And then we have the paramedic level, which is the highest level of recognized provider, and they can do anything you can expect to happen in an ICU, a moving ICU, we can do in our ambulances.
Okay, so they should not expect the ambulances to just be equipped with an EMT. They'll have at least a paramedic on there.
All of our units, including the units driving through, are paramedic-based that we'll use for primary response. I will say that if we have a giant MCI...
What's an MCI?
A mass casualty incident. Let's say we have a wreck with 20 cars, and there's a couple of people walking around who want transport,
right?
That aren't seriously injured. At that point, it kind of changes a little bit, and we're moving more towards we just need to get everybody to the hospital, not wait forever for a paramedic. So we will use an EMT level truck if one is available at that point to get everybody to the hospital. But they'll be taking the walking wounded, minor injury cases that have already been assessed by a paramedic.
Okay. How important is stabilization versus transport time in emergency situations?
So treating a patient while moving in the back of an ambulance is an art form, and it is not always easy or the best thing for a patient. We actually stopped transporting active cardiac arrests immediately at Acadian a few years ago.
Really?
And we work everybody where they are at. And by where they are at, if we're in Walmart, then we're going to stop the ends of the aisle up, and right there where the patient is lying, we are going to perform everything we can before we load the patient up for transport. Because while moving, the effectiveness of CPR drops by more than 50%.
Oh gosh, I didn't realize that.
It's just the bouncing and the moving in the back of the truck. No matter how good a job you think you're doing, every bump changes that up.
Mm-hmm.
And even having like the Lucas devices or the any of the manual CPR devices doesn't really change that, because assessment suffers with the noise in the truck and the movement of the patient. So we want it right there where we're at. We will work our patient, and when we get ROSC, return of circulation, so their heart starts beating again, we actually put everything on pause and we stabilize our patient, make sure they keep a blood pressure, make sure everything's ready to go. Then we'll load them up in transport because they're ready to go. But if you just grab them and throw them in the back of a truck, sometimes you're limited on what you can get done, and you're definitely limited on how good a job you're going to be doing.
So what would you say to residents who are concerned about response times or coverage under the new system?
I would say that I will continue to change and modify and adjust until we meet all of the expectations. So if I find any gaps in what we are currently doing, we will change what we're doing and fix those gaps. That is, I'm sending daily reports and doing daily statistics and monitoring and watching and looking for those problems.
Okay, so how will the community be able to see or measure whether the service is improving? Or do y'all post your response times and things like that? Are you transparent with that kind of information?
So if I'm going to compare it to some legacy areas, once we set a response time criteria and start turning in completed compliance reports, then it's all turned into the county, so it would be available through open records.
Okay. One of the things I've heard from people is that they're concerned about Acadian's aggressiveness in billing. People have said that Acadian sometimes puts liens on people's property and things like that. Can you address that?
I would say we're no more aggressive in our billing practices than any other healthcare facility that needs to. It is a bill.
Yeah.
And we do send people to collections. It's not a free service, unfortunately.
Yeah. And sometimes insurance covers it, but sometimes they don't cover all of it.
Yes, ma'am.
So what?
I've run into that with my own family, actually, when I've had family members get transported and they come knocking on my door asking about bills that they received. I can say for sure, unlike some other services, we do not bill for refusals. So unless you receive actual treatment from us, not just an assessment, but actual treatment, we do not bill for refusals.
Okay. All right. So what are Acadian's long-term plans for Liberty County?
Stabilize, improve overall treatment, and hopefully one day cover the entire county if it becomes available or an option for us to consolidate the rest of the county under one. The more everybody is under one umbrella, the more adjustments, trucks, and everything I can do to add to the system as a whole. Okay.
So how long is your contract with Liberty County?
Got me guessing. I'm going to say a year.
Okay.
I was like, I have a copy of it, but I don't remember. I was focusing on a whole bunch of other parts of it.
Yes, I understand. So what would success look like a year from now when the contract's being, reevaluated?
Success would be our outcomes, patient outcomes specifically, that we can maintain it long term for our employees, the company, and the county. Because it is a subsidized contract, so coming back every year and asking for more money is not something we want to do. We want to streamline it, and if we can lower it, possibly. I put that to my business development guys. My job is to be efficient with every dollar that we get, and then they will come back to me with how good a job we're doing.
So what are some things that the public can do to help EMS crews do their jobs more effectively?
I would say be a little patient at times with the crews. I promise if I mess up and we have a longer response time, it is not their fault. It is mine. And driving is always a thing. Please yield to the ambulances if you see them on the road. Yield to the right, give them some space.
Yeah, we've had a lot of, there are a lot of people in this county that have used the ambulance service for frivolous things too. And I think that probably becomes an issue. They'll call to get help with something that could be handled with other types of response or emergency personnel. I don't know what happens in those situations, but anyway. Well,
that I will say that happens across all of the districts that I serve, and to different levels. Every district actually has its own culture. Every city that I serve, I do compliance reports for I think 8 different cities, and they all have their own flavor and their own way they do stuff.
Yeah.
So I try to adapt and move and try to meet those demands. A lot of community education for those kind of situations where we have people that are overusing or possibly abusing the system.
Okay. Do y'all plan to do any community outreach, like teaching at the schools or going to the schools and having programs to show, maybe encourage kids to get into that profession?
Definitely. We already were in contact with, I know for certain, Dayton ISD. I'm not so sure about Cleveland, but as a reference, we do have a EMS Explorers post that is already going to be expanded out for anybody 14 and over that is interested, and we'll have meetings at the station, and they'll do training and CPR training. For me personally, and I actually do this in Little Cypress for the ISD in Orange, we do annual CPR training, stop the bleed training for all of the staff, any of the students. I think also Bridge City ISD. There's a few different school districts that we probably teach 700-800 people a year, hands-on CPR and stop the bleed. We also do community CPR classes for the same.
Okay. And I would assume you're going to be working with law enforcement on some of their drills and things like that.
Yes, ma'am.
Okay, so we wrap up each one of these podcast interviews with fun questions. So you just don't have to think about it. Just give me a simple answer. Okay, are you ready?
Mm-hmm. Yes, ma'am.
All right. Most misunderstood part of EMS?
That we aren't crazy and that every movie you watch is probably wrong.
Okay. One thing people should never do in an emergency?
Absolutely lose your head and scream and don't answer questions.
First thing you notice when you're arriving on a scene?
Generally, say a residence, I'm going to look for, I'm going to notice any animals, and I'm going to notice if your yard is mowed or not. It just gives you an idea.
Yeah, okay. I'm glad mine's mowed right now. I had to get ahead of the rain. Most rewarding part of your job?
Meeting somebody that you saved, even if you didn't know you saved them. I had a mom give me a hug 12 or 14 years after I transported her kid at my daughter's dance studio because she recognized me.
Oh, gosh. Well, that had to have meant something to you, right?
That absolutely floored me because I didn't know who she was, and I had to ask my wife. I was like, who's this random lady who gave me a hug?
Now, this one may not be fair because you're just learning Liberty County, but what is one word to describe Liberty County?
Varied.
Varied?
I've been trying to describe different areas that I've been to and places I worked that might remind my coworkers of, I think I described Plum Grove as part Port Arthur, part Pasadena, part Silsbee, and one of the roads was kind of bumpy, so I described it like a road in a city I'll leave unnamed. And they just kind of looked at me strange, and I was like, look, if you combine them, that in the roundabouts, which I love. I enjoyed my last visit to Plum Grove.
It's very diverse. So, biggest myth about ambulance service?
That we can fix anything.
Oh, yeah. You're not miracle workers.
We can't do.
Right.
Yes, ma'am.
Yeah, and for people who live out here, you always hear about those magic minutes or that golden hour. And it's true, like in strokes and situations like that, there's a period of time that you have to get them to the hospital. And, when you're living in a rural area, it's sometimes challenging. I guess you're working
Yes,
with
ma'am.
Lifeline and with what is it, the HCA's Air Ambulance Service.
Yep, all around the county, you have HCA, Herman, PHI.
Mm-hmm.
There's quite a few air services around, which is amazing to have.
Yeah.
And then my crew members today were asking me, they were identifying different landing zones and possibilities and asking me questions today.
So, advice in one sentence for someone calling 911.
Know where you're at. Answer questions the best you can for the dispatcher, and stay calm.
Don't panic.
Don't panic.
Yeah. Well, Robert, thank you for taking the time to join me today and helping answer some of the questions our community has had about this transition.
Yes, ma'am.
And to our listeners, I hope this conversation gave you a clear understanding of what to expect from emergency medical services here in Liberty County. It's easy for us all to take them for granted until the moment you need them. I personally have needed them a few times with my parents, and I'm always very thankful when they arrive. When that moment comes, it matters who shows up. This has been Headlines and Heartlines. I'm Vanesa Brashier, and we will see you next time.